Good evening, everyone. My name is Junaid Hassan. I have recently completed my graduation from University of Delhi in Botany Honors, and I'm myself preparing for PG entrances now. I'm not an expert in mental health issues, and all of you know that we have a scheduled session today on mental health issues, like looking for ourselves and looking for others. And we have with me two great persons, like we have Meghana, my friend, and we have Vasundhara, ma'am. She's an expert, she's a counselor. We'll start this session with the introduction, and I would request both of you to please introduce yourself one by one. We can start with Meghna.
Yeah, hi. So I'm Meghna, and I have my own mental health page on Instagram, Mental Health with Meg. And I started this page because for the past 3 years, I had been going through some mental health issues. I'm recovering right now, and I thought I'd help Junaid spread the word about mental health. Yeah, on to you, and Sundara, ma'am.
Thank you, Meghna. Thank you, Junaid. I'm Vasundhara S Nair. I am a mental health clinician and a senior research fellow. I do have my own page as well. It's called the Wholesome Mastishk, and which basically focuses on the topics of mental health and neuropsychiatry and social work and research. And why I started this page is because I realized that as a clinician, as a researcher, I tend to write research papers which goes to scientific community, or I'm seeing say one-on-one patients, but there's a huge mass out there who does not get the right information, and hence, as a responsibility of being a clinician, I started my own page, which is a month old right now. So I've come here today. One thank, huge big thanks to Meghna for connecting me to Junaid, and I really hope the conversation today will be extremely fruitful. And thank you so much, Junaid, for taking this initiative. Thank you.
Thank you so much, ma'am. Thank you so much, Meghna. Okay, so before starting or asking a few questions to both of you, I would like to tell you that I don't know much about mental health and I don't know much about the issues. That's why I really thought that I should know and I should connect with the people who know about it so that I can do my best and I can play my part. And I recently came to know about these things. I was sitting somewhere in the clinic and I read a book. I came to know about it and I really thought that we should help people and we should play our part and we should do what we can do in this field. So, ma'am, from the starting, from the basics, because in our society we know very less about these issues and people talk very less about these issues. I appreciate you for what you are doing. I would like to ask you a simple question that people have mental health issues like we have physical health issues which are very different. In the same way, we have different mental health issues. We know about the physical health issues, but we know very less about the mental health issues. So, what are the very common reasons behind the various mental health issues?
So, Junaid, thank you for the question. Now, mental health per se is a triad. When you say a triad, there are three major things that get involved. So, your thoughts, your actions, and your behavior, right? So, these are the major three areas where you see, I mean, even if one gets affected, you will see the change in the other two as well. And mental health is an amalgamation of these three. So, a effect that is happening in a negative manner to any of these three, you will start seeing a change in your behavior, in your emotions, in your thoughts. And that is why we need to be extremely cautious and give the same amount of importance that we give to any other form of condition itself. Coming to the second part of what are the common reasons why, why individuals actually develop mental health issues is one, the most important thing is there's always a second or a third priority that is being given to mental health. The the public healthcare system is extremely overloaded, and hence the focus and the care on mental health itself is very it's very deprioritized. It always gets interrupted, and people think that okay, I will focus on it a later time. not now, this is okay, we'll manage it right now, etc. Right? So there is always a second or third priority that comes in. Second major reason is the poor support itself and the lack of awareness itself that comes in. That's because people don't understand, and most of the time they don't make an attempt to understand as well. So there is a lot of inequality, there's a lot of discrimination that comes in, and all of these together makes it extremely difficult for the person, that even if they want to actually seek out for support, there's nobody actually supporting them, right? And that is a huge problem itself. So there's nobody to like actually tell them that, hey, probably, something's not okay, let's go get it checked. That doesn't happen, that's not really happening at all, right? Third, and it's very important to talk about, in a country like ours, even now we do see individuals who, rather than going to a physician or to a medical or an allopathic treatment itself, they would rather prefer to go through to a priest or other forms of those magical religious practices itself. They feel it is possession attack that is happening, or they say that something has probably gone into the body and that is the reason this person is behaving like that. So those kind of uh, thoughts are still there, very much prevalent. Though a majority has definitely come out of it, we still do have a minority which thrives through it. And that makes it really a lot of delay for them by the time they reach for care itself, right? And that's a huge problem. Another major difficulty is stigma. Everyone has stigmatized mental health so much, right? They keep telling that, oh my God, what will people think? And that outcasting that happens. And it's really sad that even in the 21st century, we have to deal with this. Then, family, friends not understanding what you're going through, or them saying that, oh, it's okay, you will get better. That's a very common statement that you're being told, and that's a huge problem in itself. Then we also have a huge problem that there are not many individuals who are trained into this area itself. So if you want to actually say seek out for care, you don't have professionals who are trained to say provide care for the amount of population that our country has, right? And then affordability. Affordable healthcare is a problem, affordable mental health care itself is a problem, and also the accessibility. Most of the individuals are like, we can't access it itself. This is something, I've heard people saying that these are the kind of services only the elite class will know. What will people like us care? So that kind of mindset that people have, that talks about the accessibility issues. And last but not the least, the amount of myths and misconception that people have, that if you have this you can't do that, you have that you can't do this, etc. So it's always a combination of all of these factors that are the reason why individuals have mental health issues, and unfortunately they don't receive the care and the kind of appropriateness that they should receive. I hope I answer your question, Junaid. Thank you.
Yes, thank you so much, ma'am. You explained it very beautifully. In fact, I also like by living in the among the normal people, I also came to know about these things, and I also came to know about these reasons which you mentioned. Like it has been stigmatized. People don't communicate, and people don't tell their friends, their family that we have these kind of issues, and people really think that this is something that's very different, having a mental health issue. And people really think a person who is like good in academics or who is good financially, he or she will not be having any issue. And it has been like presented and portrayed in such a way, and people are not able to tell to family, to friends and others about these very issues. And thank you so much, you very well explained it. So ma'am, as you know that the people who have physical issues, they might have a physical pain or something like that, but I felt like mental health is very deeply or very closely connected to everything. Like you will do whatever you will do as per your mental health. So I would like to ask you that those people who have mental health issues, because I have one of my friends who has an issue. Earlier, I was not able to understand this issue. Then I came to know, And I was monitoring her, and I was able to see that she was like behaving in a different way, and her perception towards things was very different as compared to other people. So do these persons who have mental health issues or who are have any kind of a disorder, do they behave differently? Do they perceive things differently? Is this world something different to them?
Um, Junaid, I think now when the person is undergoing the difficulty, at that time I understand it will be difficult for them because everything is like I was saying, it's a lot of changes in terms of the thoughts, emotions, behaviors that's happening, right? And when you have that, you will have those kind of difficulties, but that happens in any other condition, isn't it? Any other condition you have a difficulty, you will have this kind of those kind of say, oh my god, like say for example you have a physical health condition, you'll be like, oh my god, I find it difficult to do tasks today. Same way a person with mental health condition, if they are feeling a little difficult at that point in time, they will say the same thing, that I'm feeling extremely tired or I don't feel like doing activities, etc. But to the question that do they perceive things differently, I think it's a huge myth that individuals with mental illness will or mental disorder do perceive things differently, because no, that's absolutely not true. I mean, people, there are so many things that are said that people with mental health disorders or with illness for that matter can be, they're violent, they're unpredictable, can't tolerate the stress of studies, jobs, etc. But I feel it is a community perception. What we have been told or what we have been talking so much about it, and when as a community you start speaking about it, the person also will, you're actually telling the person itself, and that's actually kind of coloring the picture completely for them, doesn't it? I mean, the amount of stigma, the amount of things that people are hearing. But the important thing to understand is mental health condition or mental health illness is just like any other medical illness. Okay, there is no other perception that gets attached to it. I mean, and I really believe that a forum like this will help in understanding and clearing the doubts of people who think that they have a different behavior or they tend to be different than the normal crowd. So yeah, that's my answer. Thank you.
Can we say it like that they give less importance to certain things or more importance to certain things? That's why we can feel that they are behaving different towards different things and different towards different things because due to their illness.
More than that, how I would put it is that the situation for them is so difficult that they are not receiving the care for the difficulties that they are having. And when this is a very simple thing, if you are not able to cope with your own difficulty, at that time you find it difficult to even help out another person, isn't it? It's the same logic that will happen here as well, because at that time it's too overwhelming for you. And unlike in other condition where at least the other person speaks to you, says that, huh, listen, I've heard about this, maybe this is like that, here you don't even get that answer. So when you don't get an answer, that confusion causes a lot of distress, and you're just constantly asking that, why am I feeling like this? What is happening to me right now? And there seems to be no one who's actually answering that. So that is really difficult, isn't it? So at that time when you have like huge difficulty, obviously you will have difficulty in terms of responding to anything. But like I was saying, that is the
Definitely.
same case in any other condition. You take any other condition, the person will be like that. So that's the point, that it's just that here we have a second level of issue coming only because there is no answer given itself. I hope I answer your question, Janet.
You answered it very well. The question this I asked was because that I heard it from so many people. Like if they are with a person who has mental health issues, they are blaming certain kind of things that like he or she is like this, she is behaving like this, he is behaving like this, her manners are changing like this. This is because the person is not able to understand what kind of issues or what kind of problems she or he is going through. And I would like to add this thing that we have to understand this very thing that if a person is going through any kind of issue, we have to see from her or from his point of view that what she or he is going through.
Absolutely. I mean, we talk about empathy. Empathy in simple terms is about like putting yourself in that situation. It is very difficult to say that. I mean, it's more easy to say that and very difficult to do. But, it's not very easy for people to say that. I mean, you need to understand what the other person is going through. And if you don't understand, then I don't think they should be making comments like that. It's an assumption that they're living by,
Yeah.
right? And that's very, it's sad that people make assumptions about things that they probably don't know. I mean, if you don't know about something, go ahead, get yourself educated. I mean, there's so many. I mean, right now we have everything at the, in your phone, everywhere that you want it. So I think people should not make assumptions and, really take that one step of learning about it, understanding, such that they're able to help people. Thank you.
We have Meghna here. Meghna, as you introduced yourself, so I would like to ask you that if you share your story, that what actually happened and
Okay, so I think from 11 years old, I started getting all these symptoms of all mental health issues. So I didn't realize it at first. I thought something was different and all of that. And my friends started noticing it too, but it took me a long time. And then 3 years back in 2018, that was when I got help because it became too much for me. So I approached my parents, and at first they didn't understand either, but eventually they were a bit supportive, and now they're really supportive. And I got a good doctor, and they helped me out. So my diagnosis is bipolar disorder and obsessive compulsive disorder. So now I'm on medication, and I'm getting better with therapy and all of that. But that's my story. So it took me a while to get to realize that I've had this for the past 8 years, but now I'm fine and I'm good. Thank you.
thank you, Meghna. That's great. You are fine now. Okay, so I would like to ask you, Meghna, that how do you feel that people can help a person? That if somebody is living with a person who has a mental disorder, how can people help a person who has a mental health issue or something like that? How can a person play a role to help him or her taking out of this situation?
Okay, so what I feel is it's different for each person because what they have will be different. So for me, what I expected was people to just support me and be there for me. So when my parents didn't understand at first, they were shocked more than not understanding. So we tried to get educated. We went to different doctors and they got themselves educated about what's going on with me. I got myself educated, and that was the main thing. So if you know someone around you who is getting mental health issues and you want to help them, first thing is get yourself educated about it or help them to get a proper doctor so they can get educated. And that is the main thing that I would expect from someone. And I'd also expect support. I honestly wouldn't find this kind of, some people, they think these daily quotes of positivity and all of that help. Sometimes it does, it really helps me, but sometimes it's also a bit irritating, and depends on the person's mood again. So we don't know how it goes with each person. So I think it's best to ask that person what exactly they require from us so that we can adequately help them. Yeah.
Okay. Did you ever hesitate to tell it to people or to family, to friends that you have a certain kind of issue?
Yeah, I did. I still do hesitate actually, because I don't want them to judge me and stuff. But then eventually I learned that it's nothing to be judged about. If you break a leg while playing a sports, you tell people it's the same thing as that. You get dengue because a mosquito bit you, it's the same as that. So this is just another chemicals in my brain that's not proper, and that's supposed to be normal. So that's why I don't hesitate anymore. But initially, yes, I did. But again, after educating myself and going to sessions with my doctor, and she taught me a lot about this. So after all of that, I've been able to tell without, hesitating. Yeah.
That's great, Meghna. I would also love everyone who has a kind of issue to tell people, to communicate, to tell your friends, the family, and take a help to see a doctor, a psychiatrist, a counselor, something like that. It should not be. It should not. You should not hide it from anyone. It is like any other common issue, any other common physical thing. I'm going to you, ma'am. Ma'am, I read it from somewhere that while reading about the mental health issues, where the author has mentioned that after reading this chapter, you will find that you have this kind of issue. The question is that people usually get anxiety while learning about the disorder they have. So, how to deal with that?
So you're saying basically that when a person tries to understand about their own like mental health per se, they tend to get like really worried up. Is that what you're trying to ask me? Okay. So now see, I understand that sometimes when information is provided to someone, it can be a little overwhelming. Okay, especially with some people, it is overwhelming. But they also have the curiosity that they want to know it, and that is what drives them to the information itself, doesn't it? But if you feel that you're a person and you're feeling at that period of time that you are getting overwhelmed, there's always something that you can do for yourself. Instead of taking the information probably at one shot, break it down. We say that nuggets of information, the small pieces of information, you can always do that. I often find that some individuals find it like really comforting. For a matter of fact, that when I was actually, I remember in the initial period when I used to sit down with my own parents and my grandparents, and I used to tell them about, see, this is where I want to work, and this is what it is. And they used to be like, oh, is it? Now, some people would take it like, there'll be a lot of curiosity and they'll ask you a lot of questions. But I also did meet people who are like, ah, okay, this is like too much, and they need like that time to like absorb it. I always feel it's okay to give someone the time to absorb it. Let them take their time, they will come back to you. Let go at their own pace. So you can always break it down and take that as small pieces of information. Till the time you're getting educated and you're getting the awareness, it's still serving the purpose, isn't it? But it is only that if you feel that it is too much, break it down, or in another fashion, take it in a very graded manner. So I take it today this much, tomorrow I'll probably increase a little more. It's like that. So you can always do that, because when you do that, you are able to relax yourself. One, that becomes very important. And second is, when you take it at the pace that you are comfortable with, you know that that information that you have taken it in like complete sense at that period of time. It is not like you're going to not remember it, or it's really too much for you. So it's still in your pace and you are relaxed when you're actually taking it. And yes, if you feel that just one form of information is not helping, there's always multiple models in which you can take the information. Say sometimes you can talk to an expert, sometimes you can talk to your own friends, or just watch so many educational videos that come in. So information is always available in different manners, right? So we can always use what we have. So just pay attention when the information is being given. So I think that should do the trick.
That's really nice. And can we say it like that? The more we get educated, the more we learn, and we can find better ways to live happily. We can find better ways to relax our mind and calm our mind.
Definitely. I mean, also, see, the more you understand, the more you feel confident about yourself, the more you feel confident about things that are happening. And when you feel confident, you have that, that inner feeling that, yes, I can do this today. So that inner confidence is really like, that really helps you within. So yeah, definitely take it at your own pace, but yes, work towards the goal that you want. Yeah.
Okay, thank you, ma'am. Ma'am, one more thing I would like to ask is that before 20 years, do you think like people had less risk of mental disorders? Because nowadays we are seeing that the society has evolved so much, the things have evolved so much. So how different is that? Like people before 20 years or 25 years and people nowadays? Are there more stress now?
It's a question a lot of people often ask. They always feel that, maybe 20, 25 years ago, nobody spoke about all this. So how only all these came in now? So, is it only something that you people are undergoing? Now, see, there are two important things to note here. One is that, yes, agreed, there's a lot of change that happened in the last 20, 25 years. Like people migrated, from joint families, we became nuclear families, we moved from one place to another. Uh, the kind of job, the stress in job, and the environmental factors, etc., etc., all of that changed. Agreed, yes, given that point. But the most important thing to remember is mental health issues were there at that time also. It's just that nobody voiced it out at that time, or probably they didn't even know that it existed. uh, e- See, mental health factors are usually like, it can happen due to multiple factors. It can be like, you can have biological factors, or you can have your life experiences that come in, or say if you have like a family loading itself of mental health problems, or just like the situation that you are in, right? But haven't situations like this been before also? They were very much there. And even if you go back into the history of when you're trying to understand about mental health, it actually says that how it used to be present and people never spoke about it. They used to, like, close up individuals inside rooms, or just shush about it, or say people were pushed into outside the house, or say into beggary, and all those displacements that has happened. So it's not that things like this did not occur before. It was there, but people did not have the necessary awareness about it. And because of not having the awareness and so much of stigma, people never spoke about it, or probably just they just thought that this is very normal, this is how it's going to be, so it's okay. There was a standard explanation that was always given, that she can take only this much, or he can take only that much, well, the other person, it's okay. So there were very clear narratives that were there. So I don't think that, just because 20 years before, 20 years now, no, changes have occurred, but changes have occurred before also. So it's the fact that we did not speak about it then, and I think we should be glad of the fact that now people are voicing out, they're actually coming out, and coming and speaking. Like, for example, Meghna coming and speaking about this outright was not the situation 20 years ago at all. So I think now we are in a better situation, and we should be glad of the fact that we're in a better situation.
Yes, ma'am. That's quite good that people nowadays are getting educated and speaking about this. That's really nice. So, ma'am, one more question I would like to ask is that that is the most we can say the destructive outcome of the some of the mental health issues. Like not always the mental health issues, but sometimes people usually commit suicide or something like that, or try to commit suicide. I have seen in my friend circle some persons who try to commit suicide, who try to hurt themselves because they are not able to live the way they want to. So why is it like that? How is it that much dangerous that people usually try to end their life? And how can we prevent them? How can we support such people so that they can continue their life and they can make it better? How as an individual we can play a role in it?
uh, Now, suicide is it's defined as an intentional self-inflicted act, okay, that results in death. while there's a difference when we speak about suicidal behaviors. That is, it's not considered basically fatal, and more commonly it's called the suicidal attempts, right? And it is an intentional and a very repetitive behavior wherein a person starts harming themselves, right? And it's not socially condoned as well. And but there is no standard suicidal intent that comes in. So there's a lot of difference across the terms that we use. But suicide is a very serious condition that we should be talking about, because it is also considered to be the ninth leading cause of death as per the 2016 records that came in. Okay. Of how this happens is that there is an idea that arises in the person's mind, and it doesn't subside. And when it doesn't subside, at that period of time there is a suicidal desire, an intent that comes in. Okay. And that's when the person tries to attempt suicide. Now, when the person does not, like, it doesn't lead to death, it's not completed, it's not, it's called a attempted suicide at that period of time. Only when a death occurs will you call it as a suicide at that period of time, right? So this is how the entire process happens. And most of the times this occurs because this particular situation must have been too difficult or too much for them at that period of time. Like they must have tried everything, tried to, like, put in whatever strategies that they thought, and in the extreme scenario where they feel that they are not able to cope up with a particular situation, and that's when they have to they take the decision at that period of time. Now, what can we do is a very important question that I think all of us should ask and should contribute towards it. The first and foremost thing is never discount the feelings. When they are actually opening up their mind, or their thoughts to you, it should be considered as utmost serious and important. Their perception should be understood at that period of time. Second is, suicide is a cry for help. So we need to it's the indication of their emotional pain, and hence we need to focus upon it. Third is, try being a good listener. If not for anything, just like, that listening can ease off their burden itself, that pressure cooker feeling that they've been in. You just sit down and spend some time with them, it'll really ease their burden itself. Fourth is, encourage them to get help. You Professional assistance is there, encourage them to do that. And don't be afraid to ask them about their suicidal feelings. I mean, it is considered as an opportunity to understand itself, checking upon them, right? Now, another thing to keep in mind is, if you think that your friend is in danger, do not leave them alone. It is very important for you to keep that in mind, because they can have a danger in terms of hurting themselves. And encourage them, like I said, to seek a mental health professional. And if you feel that someone's telling you to keep a secret that can kill your friend, that secret should be broken at that period of time. If we can put in these things, I'm sure that we can work towards preventing suicide. Thank you.
Thank you so much, ma'am. You have explained each and every question very nicely. Thank you so much. And because of this session, I also got a lot more to learn, and I hope I will continue learning a lot more about it. Before ending this session, I would like to request you to, if you have to give a message to the people regarding this issue, starting from you, Meghna, that anything you want to tell the people, anything you want to convey to them regarding this thing, and especially to the people who are around the persons who has a mental health issue.
Okay, so my message would be to those surrounding the ones undergoing some problem, you need to educate yourself. That's the main thing, and show support. Because no matter what happens, if you don't understand what is going on with them, then you can't do anything about it. It's the same as, like I said before, if you get hurt or if they get any kind of physical illness, you learn about it from the doctor, you go speak to them, you get to know, you get their input, and then you try to help them by learning more about it. So it's the exact same way. You just need to learn more about mental health. That's my message to anybody who needs it. Thank you.
Okay, thank you, Meghna. So, ma'am, I will also request you that based on your experience, you have come across many persons who have such kind of issues, and you have also seen many persons who are living or who are with those persons who have mental health issues. So, if you have to convey something to the people, so what would you like to convey?
I think one part Meghna has beautifully spoken about, like, getting educated and showing support. I would like to add one more to that, is that when you come to know about it, don't shush it under the carpet. It's okay. You take time in coming to terms with it. Speak to people. There are people who are readily, available to help you. Come and sit down. Spend that time that you will spend in any other condition when you want to know it. Don't treat it like separate. Treat it as just normal, just the way you treat any other condition. And I would just say that if you feel that you're not able to, like, say, reach out to anybody, you try finding the person. If you feel difficult, just Google search. I'm sure there will be so many search results that you will get in. And there are institutions working across, who will be happy to help. And if not for anything, through this video you can always get in touch with members who know whom to, like, contact and how to get help as well. So use that opportunity and come out. Don't suffer in silence. Come out, seek help, and get better help, such that you are able to bring back that smile on your face and on everyone's face. I mean, there is a quote that goes saying that just because no one else can heal, your own inner work, doesn't mean that you should do it alone. You should come together and try to heal together, such that you are able to be together happily. And I really hope that we are able to do that. It's very small. All of us take small, small steps. I'm very, very sure we can achieve that huge dream of mental health for all. So that's the only message that I want to give. Thank you so much.